Well, Jessica Baker is with us. She is with Schoolcraft Memorial Hospital, and good morning.
Good morning.
Well, you are in charge of a fairly new program at Schoolcraft Memorial. Talk with me about, we just, of course, had Veterans Day, so it's timely, the Vet Corps program.
Absolutely. So the Vet Corps program is newly created, and Schoolcraft Memorial Hospital recognized that many veterans are facing unique challenges in accessing health care, especially in rural areas. Veterans often experience complex health issues related to their service, so recognizing that they deserve tailored support and resources to meet those needs. We're working in collaboration with the VA Office of Rural Health, and what we're doing there is working to bridge these gaps and enhance the quality of care our veteran community is receiving, and working to serve our veterans right here locally at Schoolcraft Memorial Hospital.
So what are some of the services, what kind of services are we talking about here for our veterans in the county?
Sure. So basically we're looking at specialty care. And Manistee is unique because we do offer a CBOC, which is a VA community-based outreach clinic. So we have a VA clinic right here in Schoolcraft County. However, when veterans need those specialty health care services that aren't available at the CBOC, and those services are offered here, we would be looking to do a referral so they could be seen locally. So often veterans are found traveling to places out of the region or to, say, the Iron Mountain VA Medical Center. And our focus is on the veteran and providing accessible community-based care right here in Schoolcraft County.
So what kind of procedures would you say would be an example of one that would be used or available, I should say, in this program?
Sure. So things like ENT doctors, cardiology, urology, we even have behavioral health. If they need physical therapy or general surgeries, those referrals can be placed to be seen here at Schoolcraft instead of driving all the way to Iron Mountain.
Now, does the VA cover the cost of this?
Yes. So that's called purchased care, and that's when the hospital steps in and does that referral process, and then the VA will cover that cost for the veteran to be seen here at the hospital.
And I guess the last question for you, Jess, is how big do you think this will be? In other words, do you expect a large number of veterans to eventually take advantage of this?
I believe that the program is going to gain some traction over time. Once we get a really good flow here at the hospital and we get the message out, I think that we'll see a turnaround in veterans who recognize that they don't necessarily have to drive all the way to the Oscar G. Johnson Medical Center in Iron Mountain. And once they learn that they can be seen here, it's going to save them time and driving distance, and they're going to recognize that they can have community-based care right here in Schoolcraft County, even though they are part of the VA.
And there is a telehealth available too, isn't there, for people that live, let's say, up in Germfast or Seney or somewhere that's not in the city of Manistee.
Yes, the VA does offer telehealth. They do telehealth very well. They have technology and iPads that they distribute out to those enrolled in the VA healthcare system, and they do offer telehealth as well.
All right, anything else you want to let people know about this before we bring Sarah in to talk about the holiday season?
Yeah, so just a quick tidbit is we are one of the most rural areas in the entire Iron Mountain, the entire VA system. So this program really emphasizes our desire to support the veteran and serve them locally and break down any barriers they may have for accessing health care. Given we are rural, we want our veterans to know that you can be seen here, and we want to make things easier for you.